Thank you all for joining us. We've had a lot happen in the last month, so I think we should get started. I'm going to turn it over to Glenn and Sherry. And again, welcome. And thanks for your commitment to this.
All right, good morning, everybody. Sally, do we have anybody new here today that we have to get introduced to the group?
You know what? I think we probably do. Do you want to just do a quick roundabout so everybody knows each other?
Yeah, let's just do that. And Sally, if you want to call it out.
I will.
Yeah, perfect. So good morning, everybody. Glenn Kasperzak, co-chair here on this committee. Again, thank you for your time and effort. We do have a great agenda today based on some feedback from last meeting, just a general discussion we had. So with that, we'll turn it over to Sherry for her and then bounce it back over to Sally there, my co-chair, Sherry Friend.
Morning, everybody. I'm Sherry Friend. I'm with Oakwood Creative Care. It's great to see you all.
Let's make this kind of quick. Let's hear your name and where you're from, who you represent. Start with Lori Marsh.
Lori Marsh, Marketing Director over at the Summit at Sunland Springs.
Thank you. Karen.
Karen Stegenja, volunteer with Oakwood Creative Care.
Thank you. Todd.
Sorry, it's Todd Carling with Fellowship Corps Mesa.
Becky.
Becky Friend, Outreach Director at Acoya Mesa Senior Living and Memory Care.
Thank you. Jacina?
Yep, Jasenia Hatfield. It's Hatfield Medical Group.
Oh, thank you for joining. Sandy.
Yeah, absolutely.
Hi, Sandy Dyke, Executive Director with Advocare Hospice.
Michelle? Michelle, we can't hear you.
How about now?
Yes, that's much better.
I'm Michelle Coldwell with Senator Kirsten Sinema's office.
Thank you. Shelley.
I'm Shelley Berry with Gateway Bank and Dementia Friend Champion.
Woo! Look at you. Nanette.
My name's Nan Rodriguez, and I'm Social Service Coordinator for Mesa Fire and Medical.
Cisco. You're muted.
Can you hear me now?
Yes.
Perfect. I'm Cisco. I'm the Program Assistant for the City of Mesa Diversity Office and Community Engagement Offices.
Thank you. Mark.
Mark Young, Mesa United Way.
Jeff.
Jeff Beer, Copa Health.
Tom
Intrieri, Commander of Mesa Police Department.
Nicole.
Hi everyone, Nicole Magny with the Cronus SCS. We're a cybersecurity company that serves the healthcare community.
Paula.
Hello everyone, this is Paula. I'm the owner of Caring Transitions.
Thank you. Teresa.
Hey, this is Therese Daraban. I'm the Emergency Management Captain in EOC for Mesa Fire.
Thank you. Jean?
Doris, Mesa Fire and Medical Social Service Team.
Audra?
Hi, it's Audra Valentino. I am a nursing director at Banner Baywood, replacing Kelly Kiefer, our CNO, and representing Banner.
Thank you. Cindy?
Cindy Rosenberg, I'm the CNO, Arizona General Mesa.
Thank you. Let's see. That's the same name. Heather?
Hi, I'm Heather Nelson. I'm a programming librarian at the Mesa Public Library.
Okay, and we have somebody who just jumped on, Suzanne.
Hi, I'm Suzanne with Fellowship Square in Mesa. I am the Business Relations Coordinator. I'm super new to this group. I think it's amazing everything you guys have done so far. And I'm really excited to just jump in and get to know everybody and see exactly what you guys are doing.
Great, thanks for being here. Okay, I'm Sally Harrison with the Mesa Chamber and just appreciative of this group. So I'll turn it back to Glenn and Sherry.
All right, great, thank you. And yeah, I was taking notes here. What a diverse group we have grown this into so many different areas that are representative, which I really think is important. And it's actually really ties in nice to our agenda today. So really excited about where we've gotten thus far. A lot of it has focused really around the dementia-friendly city component, but and obviously the challenges around COVID have created some obstacles for us, but I think we're progressing along very well. Just to kind of recap our last August meeting, just a lot of general dialogue kind of regarding issues and learning about different things. So we've kind of compiled that into here. So I don't want to belabor the August meeting update, but we continue to grow, we continue to make progress. So one of the fortunate things that we are always lucky to have is great representation from our senator's office here, and Michelle Codwell representing Senator Sinema. So if we could turn it over to you and kind of get an update on what's going on in Washington, D.C., and look forward to hearing what's coming down the pipeline. And for those of you who don't know Michelle and the Senator's office, they've been great champions of this group, and it's great to have that level of connectivity here so we can get issues addressed, but also be able to tap into some of the resources that are available through the office and the federal government. So with that, I'll turn it over to Michelle.
Thank you. So it's a really crazy time right now, because not only do we need to work on passing another coronavirus package, but we are also coming up to the fiscal year deadline. So we're trying to cram in a continuing resolution to keep funding the government, because the shutdown during a pandemic would probably be pretty terrible. So we've got about fiscal year ends in October, so a couple of weeks to get a whole lot done. So that should be a joy during an election year, which I'm sure you all know, legislation moves a little bit slower before an election. So it should be a fun-filled, packed couple of weeks coming up. Biggest things that we're working on right now, obviously unemployment numbers, we'll get a new set of numbers on Friday, but over 580,000 Arizonans reported that they weren't able to pay rent in August, which is basically the size of Mesa. So there's going to be a lot of, we do have the eviction moratorium for that Governor Ducey put in play, but that expires in October. The CDC is trying to implement an eviction moratorium as well nationally to try to curb the spread of the pandemic. They have pretty lenient guidelines to be able to make mandates like that to avoid the spread of communicable diseases across state lines. So that's something they're looking at doing. I'm sure there will be lawsuits about that. Because that means people don't have to pay rent, which means landlords are going to be negatively impacted by that as well. There are a lot of stipulations to that. You have to make less than $99,000 a year individually, or $198,000 a year if you file jointly. It doesn't absolve you of having to pay rent. It doesn't stop your landlords from charging interest and fees and all kinds of stuff for not paying your rent. So it will go through December 31st, assuming it doesn't get overturned in court before then. So that's the biggest thing. We are also, the $300 extra payment that came from President Trump's executive order, DES is now saying that will probably run out of funds this next couple weeks, which will just compound the eviction issue, as well as food insecurity issues and all of those things. So hopefully there's another package passed that includes that bonus pay. We are currently trying to work with the Department of Labor to see if there are any resources and money that DES has not taken advantage of to try to help process their backlogs. There's the new director of DES was recently quoted in the news as saying he doesn't think they will ever get caught up with claims because of how many are being put in right now. So we are trying to find out if there's any sort of money that was on the table, even from the last recession, that Arizona didn't take, that we can try to link them with. So that's kind of what's going on. It's a lot that's happening. So if you have questions, I'm happy to try to get more information or elaborate more.
Thank you, Michelle.
Thank you. Any questions for Michelle, or any areas maybe that are relative to your specific areas that you need addressed, or can provide some feedback and get connected?
Michelle, can you put your contact information in the chat for everyone?
Absolutely.
Thank you.
Great. Thank you for that update, and appreciate the senator's efforts during these trying times. Certainly a lot going on, not only in DC, but around the country politically. So understand and respect the challenges, but she's been doing a great job for us representing Arizona. So we really appreciate those efforts. So thank you for that. With that, I'll turn it over to my co-chair, Sherry, for an update on Dementia Friendly.
So it's been an exciting month for Dementia Friendly. Sally has been a great resource for us to help spread the word about us getting certified. The mayor put out a proclamation. Sally, do you want to talk about that?
Well, I can, but I think you should. You were on the call and accepted it, and you did a great job.
Yeah, but you made it happen.
Well, our mayor is very supportive of this, so it was not exactly like pulling teeth to get him to do it. But I think the proclamation is great, and I actually have it here to frame. So before I do that, I'll take a picture and get it to everybody. So if you want to use it in your own offices or on your own social media, that would be great. I do think that now we need to talk about next steps. The video is out. I think I sent it to everybody, so everybody should have that, but let's talk about where we go now.
So Karen Stegenja has been doing trainings through the Mesa Chamber. Karen, you want to give us an update on those trainings and how that's going?
Yeah, we've done 2 of the Dementia Friends sessions. We had about 9 people, I think, in the first one, and about 18 or so in the second one. And because of the second one, Becky Friend is now going to go become a Dementia Friend champion. So that's a great thing. And then Shelley Berry with Gateway is also a champion. So she's going to be doing another session. Is it September 10th? Is that your date? Okay, so she'll be doing another Dementia Friends. So there's going to be 3 of us now that are able to do that if we want to talk about how often we want to offer that. We got some good feedback from the attendees and some good questions, kind of basic, can you prevent it? Is nutrition important? What can you do? How do you address and communicate? So I think we're kind of touching people's lives as we go along, whatever their involvement has been with people with dementia. So look forward to doing some more sessions. If any of you have groups that you want to, even if it's 5 people, 10 people, we're just trying to touch as many people as we can and get as many people involved as Dementia Friends, because then that spreads in the community and supports those with dementia as well as their care partners. So if any of you have any ideas on that, we can, I know I've talked 55 plus parks, or, the banks. Shelley knows the banks. So, whether it's businesses or just residents, we'll get the word out.
Karen, can I just say one thing? Karen has been a champion herself. I mean, I just appreciate the fact that, we have a go-to in Karen, and we'll continue as a chamber to have chamber classes, and I'm thinking, maybe every other month at this point, or every month for a bit, and then, narrow it down. But I've been in several different classes now, and I appreciate Karen's. I think it's easy to follow, and just Karen's personality is easy to listen to. And, sometimes some of these Zoom calls are not that much fun. But I do think that, there's a way that we can continue to talk about this and really get a lot of individuals signed up and within their own businesses. And I think it's important. I think, we've got the autism certification for the city, and that's great. I think this is every bit as important. And frankly, to me, maybe even more important just because of some of the folks that I know who are going through this. So thank you, Karen.
Karen, could you put your email information? I went through the champion training when it first started, and I've been wanting to start something. I'm trying to do more through our organization with just community educations in general, and I'm hosting like Zoom educations on our Facebook, but I'd like to get an actual organized dementia training in place. So could you just provide your info and then I can follow up with you?
So with that, with there being several champions even within this group, I think it's important to make sure you're tracking how many people you're training, because that's a great outcome measurement for us to be able to let people communicate to people how many people we have been trained through our efforts. So make sure, Karen, that information gets submitted to you.
I was going to say, I've got a spreadsheet that I started with the classes that Karen has done. And I think if we can get people's, maybe like their name and their email address, the people that have gone through it, and then who the champion is. And that way, if we have any kind of information that we want to get out to everybody at once, you know, we can have a distribution list of people who've been trained. I think it'd be great. And Sherry, can you see the chat? Mark's got a comment in the chat room.
Mark, you always have a comment. So Mark is asking, I wonder if it would work for the Mesa United Way board, but an hour might be too long. Maybe someone could present the info and business community leaders could consider hosting a workshop. Yeah, even with my board, we're going to do a special dementia-friendly session with them outside of the board meeting. It is it's a canned thing. So in order to be like an official dementia friend, you have to go through the whole 1 hour. But work with Karen. We can figure something out for you, Mark.
Somebody asked if they could just have a video of it and show their friends. It's like, no, that's not how this works. We need you to participate in a class.
Yeah, but we can hold, I mean, especially with Zoom, right? We can hold any amount of classes at any time, really. Karen doesn't mind, staying up all night and doing a session in the middle of the night.
Yeah, I've done a little bit of shift work when I was with the police department, trying to catch all the briefings at all hours of the night. And, I guess if I know I see some of the comments as far as holding a class for Arizona General Mesa staff or Hatfield Medical Group, if you have a large enough room with enough space for social distancing and we do small numbers, I'm not opposed to putting my life on the line and doing an in-person class, as long as it's small numbers, big room, social distancing, and perhaps I'll even wear a mask and use a microphone while I do it. So that's an option as well as the Zoom virtual classes.
I do think for right now.
I'm sorry. I was going to say, we do have to report the numbers to the state. So that is something that we are going to need to keep track of. So.
I do think right now during the time of social distancing, continuing to do these sessions is probably our #1 priority, to get as many trained as possible. And then once things ease up a little bit, maybe this spring, we can work on kind of next steps as far as if we want to, things that we need to consider as a committee and work towards is if we want to create a designation for businesses that they can say, I'm certified as a Mesa dementia friendly business. We can also, there's programs to work with restaurants where you can be like a purple table restaurant where the staff are trained in being dementia friendly, and you can make a purple reservation. So that way the waiters and waitresses are made aware of the fact that it might be a little bit of a different dining experience, but it's not embarrassing for the person. There's things like that that we can work on in the future, along with the Memory Cafe, which is kind of a staple to being a dementia-friendly committee city. So keep those ideas buzzing around in your head, and probably in the next couple of weeks we can start laying out the groundwork for what that looks like. But I really think it's important to focus on getting the word out about the training. So when it does come up on the Mesa Chamber, please share it, with your colleagues and on Facebook, and let people know that that's available. They would love to see the city of Mesa and work with the city of Mesa to talk about how we deepen the training within fire, police, and the different city departments as well. I think that's an important part of this process, and maybe a conversation offline.
I think we'll end up having another program through the chamber that we'll work with Karen to get set up maybe in 2 or 3 weeks. It would be nice if at least the people on this call would jump on and, get certified so you can talk about it firsthand. And then hopefully within your own organizations, in your own worlds, you can start bringing other people in to get certified, either through the chamber's calls, or like Karen was talking about, she can go out and train. And now Shelley and somebody else, Becky can also, be supportive and train too.
So that's it, unless anybody has any ideas or questions.
We will have the certificate. We didn't really like the one that we were given, so our intern is recreating that for us. It'll be done today, but we're also working on like a badge that you can use in your signature, on your your emails, in your social media. So we'll have that done hopefully within the next couple of days also.
Oh,
So
that's awesome.
Yeah, so as you complete the class, you'll get the certificate and the badge, and we'll make make a big deal out of it as we can.
That's all I've got. Glenn, I think you're back up again.
Right, great. Just looking back on some notes, when this committee started, this came up in November 6th, actually, here. And just the progress, Sherry and the team and the chamber has made in such short order through a pandemic, is pretty impressive achievement. So something to be very proud of on this committee and the work, and the city to recognize that. There's a lot of work to go into it, and it's really a moment to pause and continue this training, and making sure that we continue to leverage this dementia-friendly program, get it out, get the trainings out, get people engaged in it, so it continues and doesn't fall by the wayside. So just put a little context and perspective around the amount of work that was done in my opinion, a very short period of time to be able to attain that. So thank you everyone for your hard work and continued support of that as well. All right. With that, what I'd like to do is kind of touch on, and we got such a diverse group of people representing many different organizations here, so I think there's some experts that can kind of touch on the next set of items regarding housing, homelessness, food banks, food insecurity, obtaining food issues, and then cybersecurity, telemarketers, scams, all of those things that are affecting the vulnerable population, where we can work to get those resources out. And it kind of segues into 6 and 7. So kind of the second half of our agenda here today will really build off of the dialogue here regarding the COVID updates. So with that, I'd like to just kind of open it up to the group and Sally to help facilitate. And I hate to call people out, but Sally, kind of, people where they sit in some of these verticals better. So not to put
I'm calling people out.
Call them out, not to put anyone on the spot, but I think just kind of looking for vulnerable issues within these topics that we can start to communicate and leverage the resources within the city, and make sure that organizations that are having challenges, or populations that are being most affected by some of these issues, one, know where those resources exist to be able to go get. We maybe develop some type of resource list that will be available as well to couple with the Mesa Chamber, and then each of your organizations be able to have that available. So with that, I'll turn it back over to Sally, and then you can start to call some specific people out for some specific updates, because I'll be more familiar in a granular sense with these topics.
Sure. I'm unmuting Mark. He's got to ask, unmute himself though. Mr. Young, come on, cooperate here.
I did.
Thank you. Mark, you want to get some updates? Because I know you guys have been in the trenches with housing, and we've got some homeless folks that need taken care of.
Yeah, we are working, the city has found a little bit over 80 hotel rooms in Mesa that we can use for emergency transition housing. A lot of that housing is being used for folks that are currently on the street. However, Mesa United Way has 10 rooms at the Days Inn out by the Windermere off of Main. And so we do see an influx of older folks that are in some trouble. It's slowed a little bit since the COVID-19 thing, but we still are having significant issues with that. So if you have people that you're working with that are in that need to transition, we hook them up with a CBI navigator and get them in the HMIS system so that we can begin to find housing for them. But we do have some emergency temporary housing for folks. And so if you have folks that need that, just give me a call. I'll actually hook you up with Harmony. She takes care of that, but we'll do that. So.
How about some other updates from United Way?
Oh, there are many, many things going on.
Yes, Becky has her, did you see that?
Yay, that's awesome. Have you done it? Have you had a chance to do it yet?
You're muted, Becky.
I'm working with our lifestyle director. We're going to make it a whole community thing with our residents and our staff. So we're working on that today.
Awesome. That's awesome. I'm waiting till next Monday to do mine, and then I'm going to Photoshop in the time so that it makes it look like I did better than everybody else. So I'm just waiting for everybody to get the stuff in. We're probably, and it's not really in the realm of what we're talking about here, but two things. We're working on a project in downtown Phoenix with House of Refuge, where we're going to be housing 7 aging out foster kids starting in November. And we have a whole program around them. It's an 18-month program to get them back on their feet. One of the things that we know is that about 60% of homeless people have been a part of the foster care system at some point in their life. And one of the ways that we can long-term affect the issue of homelessness is by dealing with it on the front end instead of the back end. So we're going to work on that with foster kids. The other thing that's available, and this is a good thing, I think, for our older generation, is this program that we do called VITA, which is Volunteer Income Tax Assistance. We work year-round helping people get their taxes squared up. Right now, it's by appointment, but it's in person. And we have a lot of older folks that have tax issues, don't know what to do, don't have a computer, can't get that squared up. And I got to tell you, the team that we have doing VITA they're amazing. So that's another piece where we could help some of your clients as well.
Thanks, Mark.
Yeah.
I don't see any of our food banks on here today. I do know that on our nonprofit call, Dave Richens talked about the Wells Fargo food distribution that they've been doing is now moved to a Wells Fargo in Apache Junction, starting, I think, next week or the week after. And their distribution at the convention center is still going strong. And then I know House of Refuge is still doing distributions on Thursday and Friday. And I saw a post that Mesa Community College is doing a food distribution. I don't know if anybody knows about that, but that was news to me. I hadn't heard about that one. I do worry a little bit. And frankly, maybe Michelle, you can add on to this, but if, in the next few months, things are starting to get cut, but we're not in a better position. I don't know where we're, you know, where does that take us for food for all these folks that have been so reliant on the food distributions. It's a little scary.
It's definitely going to be, everything's going to be coming to a culmination right at the end of September, beginning of October, when it's going to be the third month of no rent payments. It's not good right now, and we're really hoping that something gets done at the federal level in the next 2 or 3 weeks. But again, it's political right now, so we're not sure what will be in a package, if it's just going to be a standalone stimulus check package or what it's going to be looking like right now.
The Cronus SCS was on the call, and I was going to ask her to talk about some cyber stuff, but she just put a note in the chat room that she had to drop off. Michelle, do you have any cyber or telemarketing updates, anything from your side? I know it's still hitting. I'm seeing more of it, a lot more of it.
The scam calls, there has been a huge increase, especially coming from agencies now. So people are applying for assistance. So now the scammers are pretending to be the places they've applied for assistance, or they're applying for assistance fraudulently, which is a lot of the problems with unemployment right now. There hasn't been much talk on the federal level about, doing much about it right now. There's been a lot of legislation in the past that just doesn't seem to be being implemented. It's hard to track these people because as soon as you find that it's a fraudulent thing, they shut down, they start up a whole new thing somewhere else. It's definitely on our radar. And I'm constantly in communication with our policy team, and we make sure to relay all the scams, and we try to post about all the scams as soon as we know about them. So I think the biggest thing is the awareness of it. That seems to be the main way that we can kind of combat it right now, is just making especially vulnerable populations like seniors, make them aware of like, hey, the IRS is never going to call you and tell you they're going to put you in jail unless you send them gift cards. Like, that's just not a thing that they're going to do. So I think it would be great if everyone can post and be aware of it. Anytime you do get a scam call, it's always good to report it to the Attorney General's office, especially if you're a senior, because they have a senior crime task force, which is pretty great that they try to investigate those things. But as far as federal legislation coming down about it, I don't anticipate that this year, unfortunately.
Thanks.
Yeah. I had heard yesterday one of the latest scams is people pretending to be contact tracers and calling people and kind of telling them that they've been in contact with somebody that has COVID, and then they're proceeding to go and get their social security number and their personal information. So obviously based on fear that you've been in contact and we need to do this or you need to do that. So that was the latest thing that I heard on NPR yesterday.
That's scary.
Same with census. We're getting a lot of people who are pretending to be census workers as well, which is unfortunate because it makes people less likely to respond to the actual census workers. So yeah, there's a lot of that going around. Again, when you get economic desperation like this, I think the scams pop up even more because they're trying to make money too.
Sure. Scary. Yeah, Mark, you're muted.
In the last few days, we've heard about this Lewy body dementia, which was a new thing to me, you know, that Robin Williams passed from, and then Tom Seaver yesterday passed, and he had that as well. I'd just like to understand just a little bit, what is that? And is that something different than when we talk about dementia? I'm sure it's a different version of it, but how does it affect people?
Sherry, you got an answer for us?
So, Mark, Lewy body dementia is a form of dementia. Dementia is an umbrella term. It's kind of like if somebody tells you you have cancer, well, what kind of cancer do you have, right? So it is more of a rarer than the traditional Alzheimer's disease. it is a little bit more of an aggressive dementia, as far as it tends to be a little bit more on the behavioral side, a little more hallucinations. It's a little harder for the family caregiver to manage that type of dementia, is the kind of the easiest way to explain it.
Okay, thank you.
It affects a different part of the brain than the traditional Alzheimer's.
And I can speak, this is Cindy, I can just speak from personal experience. Unfortunately, my stepdad just recently passed from Lewy body dementia. It is a quick progression. It happens so quick, and his mental state changed so rapidly. We were in shock, actually, over how quickly from his diagnosis, which was about 1.5 years before he passed away. And he had changed so dramatically in that time, he was just a kind, caring man, and became very paranoid and angry. It was very sad and very scary.
It's a really tough piece.
Thank you.
So before we move on, maybe PD and fire can even comment on this, but can we talk a little bit about mental health? Because frankly, I'm worried about some folks. There's some people that I wouldn't have thought had any issues, a few months ago. Now I'm like, oh, I got to talk them off the edge almost. I mean, because there's like just some very stressed and concerned people that now have isolated and stayed away from the world. And I think to their own detriment. It's just been, it's been tough, obviously, but I'm not sure isolation has been completely the answer for everyone. And I don't know, Tom, Nan, what are you guys seeing?
I can at least speak for fire, and actually PD as well. We do have what we refer to as CM units. They are behavioral health units. So now if you are concerned about anyone, you can always call 911 and suggest to them that you have a resident that you're concerned about. The CM unit can certainly pop out and talk with them. And then too, if you know of anybody in immediate crisis, obviously we talk to people about the crisis line and all that, but we do have a behavioral health unit that the fire runs with, and I know PD has one as well.
Thanks.
Yeah, just to second that, our crisis response team, which works out of criminal investigations and the Center Against Family Violence, I know they partner with fire, and we have kind of followed fire's footsteps that they established a few years back, where we actually have clinicians that are teamed up with our detectives that focus on responding to those in need, those that are in crisis, those that need further counseling, further care, and also doing a lot of follow-ups just to ensure people's whereabouts. So I know that they've had a lot of success. I'm kind of out of the loop since I'm not there anymore, since I'm at the academy now. But I know that they've continued to move forward, and during this period, that there has been a lot of calls from patrol asking for their assistance to respond to calls to assist. So for various reasons.
Right, and we do, we have a bi-monthly meeting with our CM units, as well as our social worker, our social worker team, and PD's area too. So we focus on any resident. We notify PD, or PD notifies us, just to keep a heads up about specific names that have come up, including any homeless too. So if that's somebody you've run across, we lots of times we get calls for people that are clearly homeless, and and just they need to be followed up on. So we'll follow up on anybody that anybody has concern about.
Thank you. What about
Kelly, sorry, I just want to echo that I do think that this is a really important conversation to have, particularly amongst a group of healthcare and aging experts. I took my kids to the doctor yesterday, and we ended up in this long conversation. Their average age of the person in their practice is 30. They've lost 0 people to COVID-19, but they've lost 2 people within the practice to suicide. She went from seeing 1 person a day for needing like an anxiety release to seeing 3 to 5 people a day having suicidal ideations. So I think this is a really important conversation. I mean, I've seen it amongst, my realm of influence. And I don't think people are really talking about it. So I don't know if there's something that we can do collectively as a committee to really bring this conversation forward. But I think mental health is something that isn't being focused on, and it should be a priority.
Would you all be interested in having somebody come on and be a speaker for our next call? September is Suicide Awareness Month. I know Katie McPherson does a lot with teens, but not just teens. We had her on our women's call last month or the month before. And I mean, she's fantastic. Might be timely to talk about it, especially with kids going back to school or not going back to school. It's up to you guys. I'd be happy to arrange for her to come in and give a presentation on what's going on. Mark knows her well.
Even as employers, and making sure that the emotional health of our employees is being considered. Mm-hmm. So I do think it would be great. Thanks, Howard.
Well, I know that Gateway Bank sent out their, I think, weekly or monthly newsletter. I just saw it, just talking about Suicide Awareness Month. And, I do think it is, well, we know with kids, it's been a focus, and with veterans, it's been a focus, but I think right now it's hitting more of us. I was just curious too, and I'll go ahead and I'll work on getting Katie to come in and talk about that for our next call, if that's okay. Anybody thumbs up, hands up? Yeah, okay. But I'm curious how things are going within some of our senior communities like Fellowship Square or the Summit, or any of our other communities. How are our residents doing? Because it's been a long time that they've been isolated.
That's been a big concern of ours, and we have seen the toll it's taken, not just on the ones who are in their apartments alone, but even the couples who are in an apartment and not getting out as much. We've really kind of had to switch a lot of our attention from keeping them COVID-free to isolation's taking a toll. It's been an issue. But
anybody else?
Us too, over at the Summit, we have realized that there is that fine line between just allowing people to keep that engagement, their mind, the positivity is so important. And at this point, it's a closed community anyway. So you might as well let them be able to have some sort of engagement to be able just to talk to somebody else. I myself am covering Friday activities, calling bingo, and doing different activities with them now, just to try to draw them out. And I go knock on doors and say, we are doing something, come out, come be with us. And you can see just that little bit of time where they can just see each other's faces and feel like a person and a community. Right. It helps. So
we've been doing that too. Our lifestyle director and her assistant, they go door to door if people aren't coming out, trying to draw them out for activities. And you see such a difference so quickly. You see the difference on their face, on everything's affected by it. So still, I agree with you. We're in here anyway. keeping them safe. We've opened our dining room back up, still with social distancing and being careful. Lots of all kinds of exciting activities. And I'm feeling much better. I was really stressed over seeing the changes in our residents during isolation. Feeling so much better now, seeing the smiles on their faces and kind of that healthy glow coming back, mental and physical.
Relaxing more now again. You could see the difference in their whole body language, but it really took a hit on our seniors more than people I think realize. The isolation and the anxiety, the depression. But it is starting to get a little bit better, but it's going to be a little while still, because some of them are naturally extroverts, so they're engaging, but there's the ones that aren't, so they're naturally going to isolate anyway, so it's been difficult to try to kind of pull them out.
Yes, it has. Our memory care unit, because that's a whole different little community, we haven't even tried to do any kind of isolation with them, but we're very careful about who goes in and out. So they've done okay, but the dementia patients that are still on the assisted living side, we've really had to watch carefully and make sure they're doing okay.
One thing that we are looking for and going to be putting in place is being able to have some of our volunteers come back in a one-on-one arena, where I've noticed, like our bed-bound residents, to be able to find volunteers that are willing to do one-on-one visits with them through like a tablet, a pad, and be able to sit there and have a conversation so that they can see them for 20 minutes, or play a game or talk to them. Since we probably won't be able to have the volunteers come back into the community in the regular way, but if we can find other volunteers that are interested in supporting the seniors that way, and especially ones, this is how I would like to see our dementia friendly outreach happen, is these people that are interested in learning more about dementia friendly, of being able to have them be the conversations with those residents. They might not be full on cognitive decline, but there's something that is going and they're already in the community. So who would be interested in, in having that one-on-one time with them?
Thank you. I have a couple of other, oh, go ahead.
One thing about that, Lori, have you connected at all with the ASU School of Social Work?
No.
So for the Bachelor's of Social Work program, one of their semesters, they have to volunteer for 40 hours for an agency. And I'm sure that it is difficult to find an agency to volunteer at right now because of all the restrictions. So it might be worth trying to network with them to see if they can put you on the list of agencies that are accepting volunteers for that.
Okay.
I'll see if I can find a contact to connect you with.
That would be great. I put my email address up in the chat box.
Perfect.
Thank you.
Thanks, Michelle. That's a great idea. I have just a couple real quick things. If you guys haven't taken advantage of the CARES program, the technical assistance piece is still in place, and there's a lot still to offer. I know, you probably have all the PPE you need, but if you don't, there's still that as part of the program. There's website development. I mean, there's like 30 things to choose from. So take advantage of that, or tell your friends to, because the money that doesn't get spent through that program, it has to be returned at the end of the year. And then also the city's still working on the hydration campaign. Thank you to the summit for your work last week on that. But as much as the summit did and others have done, there's still a need. And with our hot summer that we've had, there's still a need for more water to be donated. So if you've got opportunity to do that, or know of a business that you might be able to hit up for a pallet of water, that would be awesome. With that, I'll turn it back to Glenn.
All right, great, thank you. Fantastic dialogue around that. Great suggestion, bringing up the mental health piece, and we'll probably close out with some discussion around that. But we'll turn it over, again, Sally, most appropriate person here representing the many departments in Mesa that maybe can talk about some of the resource availability, or if there's portals or areas that, you know, individuals or organizations can reach out to get some of the support regarding some of the topics we talked around: housing, homelessness, food, and the cyber issues that are out there. I'd be curious, and then maybe we can tie that back in and just make sure we're linked up on the Mesa Chamber website as well, so the group has a lot of venues to go and try and get resources and assistance.
Cisco, got
Yeah,
any
so
updates for us?
you know, listening to Lori's idea about the volunteers reaching out to seniors and doing a home iPad type deal, that's fantastic. And I'm not sure how many of you are aware, but the city's been operating the Adopt a Grandparent program, where volunteers actually go out to food distributions and they take food to homebound seniors. And we're limited in the fact that there's this vast pool of volunteers, because we have, you know, hundreds of volunteers a year that like to come out to city events and like to participate in these types of programs, but our capacity to provide them with volunteer opportunities is limited because of the pandemic. So a program like what Lori mentioned would be well received through our volunteer pool, definitely. And then I did have one more question. So we get a lot of calls in our diversity office about where to connect seniors to resources. And I was looking over at our website, and we have the really general governmental type resource pages: the Arizona Attorney General's Office, the Senior Task Force, the Child Welfare League, the American Society on Aging, and ASTR. And I was just curious, you know, if you guys were willing, you know, if you guys can submit additional resources that we can post on our website, that way we can get, you know, as much word out about all the good work that, you know, this group and all your organizations are doing. I think that'd be tremendous, because these pages are well received and they're really utilized. So I'm going to put my email in the chat box as well, and I would love to be connected and hopefully get those resources up on our website as well.
Cisco, maybe you and I can chat, and we can try and coordinate our website for the chamber, which would include all these folks, and your website information, and make sure that, you know, we've got everything we can on both.
Mm-hmm. Yeah, I mean, that sounds great. The more codified we can have our information, you know, in a widespread variety, I think that'd be great. So I'll definitely shoot you an email, Sally. Thank you.
Thank you. All right, Glenn, yours.
Great. Thank you for that. I think that's a great idea, and having a list of resources available is certainly important. So with that, I know we're coming up here on the top of the hour, and the last item on the agenda is topics for the next meeting. And we'll work on having Katie come speak regarding mental health issues. Are there any other topics, or can anyone recommend a speaker, you know, maybe for the next couple months? You know, we're still working through COVID. I've noted some follow-up items from today's agenda, but maybe we can get a couple different speakers lined up relative to some of these key social determinant issues, not only impacting the folks we work with, but also our employees, and making sure that we're taking care of our own as they're trying to help members in the community and others who are in need through this challenging time. So just thoughts from the group on key areas, and then we can work, Sally and Sherry, to find some great speakers, and maybe even open the meeting up a little bit more to a wider audience from the organization, so people can attend a 30-minute webinar, and then we can do 30 minutes of business. We can kind of sort that out. But carries from the group.
Michelle, would the senator have time to join us at some point?
I can certainly inquire about that with our scheduling team. Do you have a date in mind of the next couple meetings?
Well, typically we hold them the same time. So what is this, the first Thursday of the month at 8? But I think people on this call would understand if we needed to adjust that for the senator.
Yep, let me see what I can do.
That would be great. I think it'd be good to hear from her on that level. Any other ideas, guys?
Yeah, Sally, Tom from PD. I just want to bring a couple of things to the attention of the group as we talk about aging and healthcare and the elder community, and we talk about their mental health and wellness during this pandemic. I understand this pandemic is affecting everybody in different ways, but I just want to bring to your attention that some of these numbers that I've heard recently. And I worked in this area for a while, so I do speak from some experience. There's over 800,000 children that are reported missing each year. Many of those are abused. Some of them are running away from difficult situations. They are also our vulnerable population. And with that being said, I know personally, because I do talk to these folks still, the Department of Child Safety here in Arizona, their calls for service over the last 6 months has gone down 60%. I know at our center, the number of cases involving children and domestic violence has gone down significantly as well, because of the pandemic, many of these people are stuck at home with their offenders. So I also would like to echo that, and I don't have the numbers on this. Obviously, elder abuse is going to be up in those cases where elders are being, cared for in private entities, private locations. So I just want you to bring awareness that although the virus appears to be somewhat dangerous to some, I think the overall impact that this has had on our society and the vulnerable, the truly vulnerable, has been tremendous, a tremendous negative impact. So I'm hoping for some sanity and some semblance of normalcy to be presented to us by our elected officials here shortly.
I think a call on trafficking would be awesome.
Yeah.
Anybody else have an interest in that?
No, I think that's a great.
It's bigger
great
than most people
point.
understand.
Yeah, I mean some of the other areas too, you're reading it and it's not getting a lot of publicity. We talk about mental health. This is the opioid, abuse and drug overdose, as well as another area that they've seen actually an increase. And then the other piece too that I've just started to read some stories on is where people are not going to their doctor. They're not getting diagnosed. They're starting to see increased rates around people having more critical cardiac arrest, stroke, different types of healthcare that are actually impacting their life and having negative outcomes. So there are some other relevant topics that aren't getting as much airplay right now, like the trafficking, and it's very sad that that's happening because people have been locked in the box per se, and getting kids back to school and people out will, hopefully start to identify those issues. So I do like the trafficking as well. Any other suggestions on areas?
This is Ken Staker. I'm new to the chamber and one of my first meetings here, so I'm really happy to meet everybody. I run a technology, cybersecurity company. We're focused completely on healthcare. Vista Senior Living is one of our new clients. Been working with Chris Woolley over there. So Lori, I'm sure we'll chat with you soon. But I'm really intrigued about this security for seniors, and that's an area I'd really like to discuss with somebody. I don't know if there's anyone on the call that would be open to kind of help me understand some of the issues there, but I think there's some things that we could really do to help in that area if you can kind of direct me the right way.
Ken, I'll reach out to you.
Okay. Very good. Thanks.
Kelly?
Yeah.
So Jeff Baird, Copa Health. We have a conference next week on resiliency during a pandemic. And one of the subjects that's going to be covered in the afternoon session is the increase in domestic violence since COVID-19. So I'm not sure if that's a standalone or maybe something that gets brought into some others, but we have a gentleman from the Mesa PD there. The numbers that we're hearing about are increasing at an alarming rate. So I'm not sure if that's a topic or not. Thank you.
Thanks, Jeff.
Sally, I'll circle back to you. I mean, I wonder if some of these can be coupled up, or some of the speakers that potentially can kind of touch on some of these subjects consecutively. So I think they're all very important and could certainly stand alone by themselves and probably consume a whole hour of our time, and even more than that, with discussions, questions, and answers. So lots of good feedback today. I appreciate everyone's input. Love where we're going as a committee. Love we're working through the challenges of COVID and Zooming to meetings. It was interesting. I'll close with this. I was reading an article from an economist, and only 5% of the business travel has resumed post-COVID. And the reason is because everybody is, quote, Zooming away. So we're still making progress on meetings here despite those challenges. Everyone's, your time is very valuable to us, and making a difference in the Mesa community is important. So with that, I will thank you, and we'll reconvene next October, the first Thursday there. So Sally, any closing thoughts, or Sherry, any closing thoughts before we end today?
I think we're good. Thank you, Glenn. Thanks everybody for being on the call.
Thank you, everybody.
All right, thank you, everybody. Be safe. Have a great Labor Day weekend.
Be safe.